the Global Institute of Public Health, we attack public health problems by bringing people who have a different way of looking at that problem together in the same room, in the same space, to see whether together we can find an even better solution to a public health problem, a better way to save more lives than we could alone in our own disciplinary boxes. The vision of GIPH is to leave the world a better place than we found it. And in order to do that, as a public health professional, you can advance knowledge about important unanswered questions. You can train people to use the state of the art in helping to impact a health problem. And you can provide direct service to communities and study how well one type of approach works versus another.
The Public Health Research Center is doing a longitudinal cohort study looking at causes of cardiovascular disease and diabetes. And tobacco use is one of the leading causes of cardiovascular disease here and throughout the world. We're including questions on people's use of tobacco, all forms, in our survey. And we've also initiated a bunch of other projects across UAE looking to help people quit smoking.
We're currently doing a study of water pipe tobacco use, and we are going to be comparing populations of university students in Abu Dhabi, Turkey, and New York City.
We're going to be using the results from our research to create and implement cessation plans that are appropriate for the culture here in Abu Dhabi and Turkey, because it's been shown that culture often affects the way people practice certain behaviors.
The PHTT, or the Public Health Think Tank at NYU Abu Dhabi, was a group challenge conference, which means that we invited students from across the UAE who are interested in aspects of public health to come together and work in teams against a challenge.
And the idea behind the conference was that we wanted to engage with a public health issue within the UAE, something that was really locally relevant.
The challenge this year was tobacco usage in the UAE, so teams worked together to come up with a public health intervention for the problem.
And I think what we were most proud of was really having people be so engaged with the topic and being willing to learn from each other and to take that and make that sort of more of a long-term learning process about the public health issue within the UAE, rather than trying to come up with a quick magic bullet solution.
I think the strongest point of this project in this entire conference is that it incorporates problem solving into students' psyche, right? So it teaches students public health methods and it teaches them about these problems, and then they can go and spread awareness. And I think it's a great educational tool for public health and against tobacco.
The tobacco control is an essential element of the Public Health Research Center. And what we do is we help and we support smokers in their attempts to quit smoking. And we are here to help the public and the population and the citizens of the UAE.
So we just published, and it just came out this week, a paper on adolescent perceptions about smoking just a few cigarettes a day. This particular paper is especially worrisome in a number of ways, in that it shows the remarkable lack of information amongst the nation's youth. This is remarkable and important because the numbers of people who smoke and the numbers of people who smoke lesser cigarettes are both increasing in the United States at the same time that there's evidence that the lowest levels of smoking cigarettes are dangerous both to your heart and put you at risk for lung cancer.
So the New York University Global Institute of Public Health is an innovative program. And what's unique about GIPH really is the fact that it brings together a multidisciplinary team. What GIPH does, and the strength of GIPH and its uniqueness, is really the ability to actually draw upon the very many schools and very many disciplines that we have at NYU.
My vision for the Global Institute of Public Health is to make it a truly world-class entity reaching out around the world to improve the health of populations. In order to do that, we need to bring to bear as many disciplines as possible, and we have to apply them to the most important public health problems, to orchestrate our efforts to provide the best education, the most cutting-edge research, and in doing so, improve the health of the public, not only here in the U.S., but around the world.